other inputs, and including extension services on a digital platform. For the first time, we managed to cut out brokers, we managed to cut out cartels who normally gave us so much problem whenever we had a subsidy program. They would buy subsidized fertilizer, repackage, and go and sell it. But this time round, technology helped us to deal with them. And they must be very sad people because they never got a chance to pilferage our fertilizer. And as a result, we have this year's maize harvest, for example, is going to be 15 million bags more than last year. Similarly, millions of hustlers have been able to register with the Hustler Financial Inclusion Fund and received affordable credit that is not necessarily secured by anything other than their ability and their credit rating in terms of how they pay. And they can now grow their credits, grow their businesses, and meet other financial needs. At the same time, we are now able to provide Kenyan learners all the way from early childhood development and education stage to the tertiary levels of university, various colleges and institutes, as well as technical and vocational education and training, with financial support and capitation in order to improve the quality of facilities, provide more teachers, improve the curriculum, and make education affordable in our institutions of learning. I was having a conversation with CS Machogu on the applications that now are online for all our children who are, all our students who are going to our TVETs and our universities. We had to work with the technology providers to make sure that it expanded the capacity for the hundreds of thousands of learners who are applying. And I am very confident and I'm very happy that technology has made many things easy, affordable, efficient, transparent, and accountable. Our universal health coverage, as was said ably by CS here, is off to a very brilliant start with the recent launch of the Community Health Promoter System, which will provide preventive and promotive health services at the grassroots countrywide and facilitate diagnostic and early detection of conditions requiring curative attention to Kenyans from the comfort of their homes and in all instances free of charge. All these interventions have made unprecedented progress in expanding inclusion, enabling previously marginalized groups and households who are typically the most vulnerable and in need of these opportunities, both in terms of participation and contribution, as well as receiving support and benefits. More households are now involved in gainful economic activity in various sectors. And as the bottom-up economic transformation agenda gets underway properly, this positive change will begin to demonstrate manifest progress. If what CS Nakumicha is anything to go by, we are shedding off a lot of baggage and a lot of unnecessary paperwork and a lot of cumbersome processes and making it simpler because of the benefit of technology and because of digitization. The provision of various services and opportunities to Kenyans has relied on finding the most efficient means of expanding access and enhancing inclusion, devising the best modalities of guaranteeing security and reliability, and formulating the most effective instruments of evaluating the nature and extent of need and fixing it using technology, digitization, and building of networks. Our farmers interact with extension services without leaving their homes or farms because extension officers facilitate them to register and submit relevant data to update their input, what type of mechanization they want, what kind of diseases they encounter, and what kind of pest control measures that would make them much more productive, as well as all other needs. Similarly, the National Education Management Information System constantly updates relevant information about every learner and their socioeconomic background to ensure that the means testing instruments remain accurate and reliable in determining the learner's level of financial and other needs. The ASLA Fund has been able to serve millions of Kenyans from all walks of life, especially and consistently and conveniently and repeatedly